what has been achieved. 5 million has been raised, and we've worked very hard on building the platform and proof of concept. Now, if you then say, what is this platform? No, this platform is the marketplace. This platform is the scalable technology platform with the 4 dimensions we addressed earlier. So number 1, the B2B and the B2C retail engine, so to speak. So where a consumer like you and I can engage with healthcare and healthcare services. So the retail side, number 1. Number 2, the more FinTech side, let's call it banks, telecoms, insurance, grants. So a platform part that enables to interact with these services and parties. Number 2. Number 3 is a pharmaceutical brand platform where in principle providers of pharmaceutical services or generic pharmaceutical services can market their propositions and products. And then finally, fourthly, the provider side, so the doctor concierge services, where we allow people that are in healthcare as a provider or as an entrepreneur to run their practice or run their business, basically, so the patient management, patient record. So that platform has been developed and established based on those 5 million that were invested into the company. To date, around $1.5 million of revenue has been generated by Ponea on the platform. We've served in the proof of concept phase around 20,000 consumers with health services, and we allowed those 20,000 consumers to interact with around 1,000 providers, so providers of healthcare services. So that's what's been achieved. And as said, a lot of lessons have been learned, which will now be used to move from the proof of concept into the commercialization phase. We have to date only raised money from angel investors, and in parallel are running a variety of dialogues with potential new investors, and we can talk a bit more about that. But in principle, what we want to do as we move from the proof of concept phase into the commercialization and scaling up phase, we would also like to start shifting our investor base from angels to more impact and or corporate VC type investors. So that's the journey we are in. In November, December, we did have various dialogues with our existing investors to see whether they wanted to extend, also looking at the current environment in investment venture capital, to whether they could extend or wanted to invest some additional funding into the company, so we could basically continue the work of the company around proof of concept. So that was more a reach out to existing angel investors than onboarding of bigger new types of investors. But most importantly, what we're looking for is investors that not just bring money, but bring a bit more. And that a bit more has on one side that is completely passionate and on board with the mission and the vision of what we're trying to achieve. So the improving access to care, or democratizing access to care for underserved populations. That's a passion side, and the other part is what they can contribute from helping us commercialize and scale. Right. So, do they bring experience or go-to-market capabilities in certain market? Do they bring complementary experience with FinTech? Do they bring certain experience with digital marketplaces in the healthcare domain? Now, if you look at those 2 dimensions, so a similar touch and feel beyond money, including passion and capabilities, then you often get more to, for example, impact investors. And that's why also we're looking and having a variety of dialogues in Europe, but also the US, to really attract impact investors. Number 1. Number 2, indeed, corporate investors are interesting as long as they indeed have a similar view on what the opportunity is here and how to best unlock it. Right? Africa, access to care in Africa is a very specific area of attention. So we need to make sure that we're on the same, we think about the opportunity and how to unlock it in the same way. And of course, venture capitalists that have been investing in this domain before would also fit. But the most important part is shifting from the angel investors to a different type of investors, which would of course then also help us create a further step up in our governance and board structure, because that is also what we would expect from some of these investors.